Let's do this. All right, so gallery view. All right, so let's jump on the question, what if the patient dismisses you, right? That this was another question that Noor you had, correct?
I had this question. This is
Sorry, who had this question?
Denise.
Okay. All right. So, okay. So dealing with difficult patients, right? That is a very common thing. Dealing with difficult patients is very important because that happens all the time. You have a difficult patient. You have a difficult patient, and that patient, messes up your whole day, right? Anybody who's actually worked in a clinical setting, they know that one patient can actually mess up your whole day, right? How did you handle that question? If you're okay in giving a answer.
Can you hear me?
Yes, Binesh.
Yeah, so I answered that in medical field, we often deal with patients who are feeling anxious, or they are feeling that they are not heard. So I always try to understand my patient's point of view. I start by giving them some space so that they have an opportunity to voice out their concerns. And when they are done, getting, all that frustration out, I will then go on to address their concerns and tell them that what they are feeling is genuine. And I always try to stay calm in such situations. So I think just by listening to their concerns and telling them that what they're feeling is genuine and I'm able to understand it, most of the times I'm able to deal with those patients.
Okay, great. Yeah, so absolutely. Yeah, definitely it does happen that there are patients who may be a bit more difficult than others. And I've learned to realize that this is largely because they are under so much stress and anxiety, and they're in a different environment, and things are happening to them on a daily basis that they might even comprehend. And it may be a fault of the medical team or myself that I have not communicated properly. They may be getting different and diverging opinions from other people around them. And anything can happen in the hospital or in a clinical setting where things are delayed. They could get a little angry or be a little irate because of the multiple aspects that they're going through. And we have to look to put us ourselves in their shoes and see from their standpoint. And when we are there talking to them, we will definitely look to hear them out. We will say that I understand what you're going through. I understand that you are under a lot of stress. We have to definitely empathize with them. And at the same time, we will give them the space and the room to breathe. And we will look to sit down and say that, hey, here I am, and I'm here to help you. And let me know what are your concerns, and we can look to address all of your concerns. And we will hear them out and look to provide them with the information that they need and look to address their concerns. A lot of times I've seen that in my little experience, that if you just take a few minutes to listen to the patient, you may find the solutions that will make your job easier for yourself. And you will be able to address the patient's concern in a much more appropriate manner. So I think communication is the key to addressing any difficult or a patient that is difficult to deal with. Yeah, thanks for asking this question. All right. Anybody wants to take a jab at it? These are questions being asked, so I think it's better to prepare, right? So these are questions being asked. Anybody? Anyone? Going once, going twice.
Hi, Dr. Khan.
Yes, Momna Nasir. You want to give it a try?
I'd like to try. Can you?
Okay, great. So Dr. Nisar, so it happens that every week there's one patient that is difficult to deal with. It could be that their medications are messed up, or it's taking too long for somebody to show up and answer the questions, or one of the family members are just, very nosy and they're getting the patient upset as well as creating a scene in the room. So how would you handle a situation with a difficult patient, perhaps? Yeah, this happens a lot. Have you experienced a similar episode in the past, or how would you handle how would you handle such a situation?
All right, thank you so much for asking this question. I do believe that situations like these can happen in a healthcare system because of the pressure and the workload. However, it is very important to be patient in these situations. The first thing that we should do as physicians is try to analyze when we enter the room of the patient, what's the like how the patient is, what the family is thinking about at that time. And if we do face difficulty in talking to a patient because of the presence of other people, and the patient actually wants the family not to be there, then it's really important to have a one-on-one interaction with the patient in a way. Not only that, but it's also important to ensure that your nonverbal clues as a are more friendly, and then the patient feels that he's being like heard and understood. So the most important thing is to make the patient comfortable first, and then we can actually start conversation about the problem that the patient is facing.
Great, great, excellent, excellent, excellent. Anybody else wants to just open up, ease up on answering questions, just to feel light?
Dr. Khan,
Yes.
I wanted to ask you what they meant by the patient dismisses you. Like, does it mean that the patient does not agree with your treatment or management plan, or do they not want to be treated by you?
Okay, that's a good question. Yeah. Dismisses. So it could be taken both ways. If the patient dismisses, a lot of times the way it's taken is that the patient does not want to see you anymore. Yeah, that's one way to understand it. The patient does not want to see you anymore. Was the person who asked this question, was that person like a native English speaker, or is English with English as a second language?
She was a native English speaker, I guess.
Okay. Okay. All right. So I think the way I think probably this would be that if they dismiss you, they don't want to see you anymore. Okay. That happens a lot. I mean, it doesn't happen a lot, but it could happen. So I think that's a good question to ask. So the way we will approach it is, again, same approach, empathy, communication. So you would approach it like this. Well, that's a good question, and I do believe that situations such as this can happen. And when such a situation happens, I think the first instinct for any human being would be to be taken aback and be upset. But I have realized, and I've seen some scenarios where, again, you have to be a professional individual and uphold the standards of the ethical standards of this profession to the highest degree. And in any situation such as this, I will look to sit down and approach the patient that I understand that there may be some concerns that you may have, and I fully would always agree with your decision in any matter. And but I would like to know a bit more detail if there was anything that I could improve upon, or is anything I can help with, that we can look to resolve any issue that you are having, and I could continue to serve you in any capacity that I can. But of course, there's no pressure at all, and but I just want to know if there's anything I did wrong, or anything I could improve upon or work with, and please share with me any issue that I've possibly let for you. So the patient will communicate if they agree, if they realize that I'm trying to analyze the situation, and if they are comfortable in sharing their issues, then I will listen to them, and I will look to address them, or any confusion that they have. I will look to remove that confusion or readdress it in a manner that they're able to understand, because as we know, all of these issues happen due to communication usually. And I will look to try to break down any barriers, and I would at the end suggest that hopefully I was able to come, and hopefully I was able to hopefully I was able to address your concerns. Do you think do you think this was reasonable? Is there anything else I can help with? If they don't have anything else and you have developed a good relation, you can ask the patient, is it okay with you? And it's totally up to you if I continue to see you and take care of your needs. If they say yes, I would say, well, thank you for continuing to rely on my care. And if they say no, I would say that is perfectly fine. And if there's anything else I can help you with, please let me know. I will try to find a suitable replacement for myself, and I will give them a brief about your care so far, and they will look to take over from here. Okay. So I think maybe that's the way you can approach this. All right. Okay. All right. So anybody wants to give it a try? Anybody wants to give it a try?
I can give it a try, sir.
All right. Armit is the brave one here today. Okay. 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 So Dr. Khanal, so okay, ever had an experience where a patient is saying that they don't want you to be their physician anymore? Have you had that, or how would you deal with such a situation?
Thank you very much for the question. Yeah, I remember one moment when I was working as a medical officer in the emergency department. 26-year young male, he arrived to the ER with abdominal pain, and he was moaning in pain, and we were a bit in a rush, and nobody could attend the patient at the moment, and he was very angry and frustrated. And ultimately, when I approached the patient, then he was very angry, outbursting with anger, and he was saying that I don't want to see or taken care by you, but being myself calm and composed and being more professional, and taking care of patients is our topmost priority. Keeping that in mind, I approached the patient and I asked why he was being frustrated. Then he told me that it's already 15 minutes and no one is here to attend me. I am very frustrated with this pain. So uh, I I went there and then I said, I am here now, so I can do anything for you. What are your concerns? And I provided him a I provided comfort to him by saying that I will take care of the pain for you. So he was bit calm down at the moment, and he complied with the care that I was trying to give him. So that was the moment I de-escalated the anger of the patient. And we sometimes need to act quick, because in the rush we may not attend all the patient at once, because there are more severe patients than him at the moment. So yeah, that was the time when I addressed the patient issue, and all keeping the patient care at the front. I became calm and composed myself. I did not let my anger take upon it, and that's how I dealt with the issue. Thank you.
Great. Yeah, you had an example, and the example was realistic enough, right? It was a fairly realistic example, because this happens a lot, right? And yeah, that's how you will deal with it.